School Lunches, The Healthy, Hunger-Free Kids Act by Nicole Madden and Aaron Cobb. Being First Lady of the United States means much more than just being married to the president. First ladies also get to participate in American government by creating programs called initiatives to help improve the country. Michelle Obama chose to focus on the health of the nation's children. Michelle Obama, the wife of President Barack Obama, served as First Lady from 2009 until 2017. Before becoming First Lady, Mrs. Obama was a lawyer in her native city of Chicago. She also worked as a dean at the University of Chicago and as vice president of the University of Chicago's hospitals. Let's Move. Mrs. Obama created an initiative called Let's Move when she entered her position as First Lady. This was a public health campaign with the goal of reducing children obesity through exercise and diet. The Healthy, Hunger-Free Kids Act was part of the Let's Move initiative. It was approved by Congress and was signed into law by President Obama in 2010 and took effect in 2014. The Healthy, Hunger-Free Kids Act created and expanded free lunch programs in schools across the nation. For example, the law states that all students in schools with a 40% or higher poverty rate will receive free breakfast and lunch. It also provided for after-school snacks in these schools. About 115,000 additional children gained access to free meals through this act. Finally, it increased free meal access in the summer months. The law also created a new set of standards for nutrition. Schools were given more funds to help them get fresh, locally grown fruits and vegetables. Schools also received resources to help them get healthier foods. Finally, it created minimums and maximums designed to increase health. Limits were placed on unhealthy milk varieties. Portion sizes were decreased. Students were required to receive a minimum amount of fruits or vegetables at each meal, and a maximum was placed on salt, sugar, and fat. Schools that followed the rules were rewarded with additional funding. That means they earned more money for providing healthy meals. The visual, My Plate, was also released to help families create healthier meals at home. My Plate recommends that a plate is divided into 30% grains, 40% vegetables, 10% fruits, and 20% protein. My Plate suggests reducing sugars and salt and increasing whole grains and vegetables. A 2016 research study showed that the law worked well. The study looked at how many children participated and how nutritional the food was based on essential vitamins and minerals. They found a significant increase in food healthiness since the creation of the law. Some have criticized the program. One criticism is that it restricts choice by requiring schools to limit the types of food they serve. Another criticism is that children might not eat their healthy foods, but instead throw them away in the garbage, creating food waste. Some school districts are also worried about what the program costs to run. Some students have complained on social media that their school lunches are too small and not tasty enough. 2018 changes to the law. In 2018, opponents to the law managed to roll back a few guidelines on the nutrition content of school lunches. These new, less strict guidelines allow schools to serve high sugar-flavored milk. Schools can also give their students meals with higher sodium content and fewer whole grain-rich foods in favor of refined grains that are considerably less healthy but perhaps more appealing to some students. U.S. Agriculture Secretary Sonny Perdue claimed that under the Healthy Kids Act, schools have faced challenges serving meals that are both appetizing to students and meet nutritional standards. Perdue said, "If kids are not eating what is being served, they are not benefiting and food is being wasted. We all have the same goals in mind, the health and development of our young people. USDA trusts our local operators to serve healthy meals that meet local preferences and build bright futures with good nutrition." But the new changes drew harsh criticism from health and nutrition experts. In its statement of opposition, the American Heart Association said, When it comes to our children's health, there should be no flexibility. Failing to meet the science-based sodium standards for school meals originally adopted by USDA will put kids' health in jeopardy. We strongly believe that all schools can meet the original nutrition standards. It is in the best interest of our children for schools to keep moving in the direction despite the latest USDA rule.